Well, joining us this morning is Dr. Scott Smith, an orthopedic surgeon with Texas Orthopedics, to explain what these injuries are and what folks can do. Thanks for being here, Dr. Smith. Tell me a little bit, runners, they still have a little bit of time. What should they be doing today ahead of the race tomorrow?
Today's a day of rest. They should be taking it easy a little bit, propping their feet up, eating a good diet, get some carbohydrate loading, get hydrated for the race tomorrow because it's supposed to be warm.
And what are some of the injuries that are typically associated with marathons, half marathons, even the 5K if someone's not careful?
If you haven't trained enough, you can get injured anytime. Almost every runner will have something, a blister, some chafing, maybe a lost toenail, and those are first aid things. The bigger stuff are, muscle pulls or sprains or strains, but again, those are kind of self-limited.
And people who have trained, they are determined to cross the finish line, but when should they listen to their body?
Oh, that's a tough question because it's at the end you'll see lots of runners really struggling. Typically, though, that's self-limited things that'll get better over a couple days. If you're having some serious complaints, chest pain or dizziness or decreased sensorium or some confusion, those are immediate things you got to get taken care of. The more aches and strains that don't go away over the last, say 3 days or 4 days, you should probably see somebody if they're not getting better.
And when you say those aches and strains, some of those can really stick around for a while and really just aggravate and change quality of life kind of thing.
It will definitely, like some knee pain or foot pain, that's very common in runners, especially after a long race, a 26-mile race, and they typically will go away with some shoe wear modifications and altering your training, and preparation is really the key, which is a little late for tomorrow's race.
But there will be people out there that just decide to go run.
To go run it, and I'm with them. A marathon is a fantastic accomplishment. I have never run one.
Nor I. So we sit here talking about it, but not running.
Right. I will take care of the patients. Hopefully, there won't be hardly anybody that gets injured significantly.
And say someone has an injury tomorrow. Heat, ice.
Yeah, what do you do post-race? The main thing is to get hydrated first. To reestablish kind of a normal. You have to make yourself urinate a couple times. So that's the first thing, and then using a non-steroidal anti-inflammatory if your health's good enough to take it. Get your calories back up. Rest the next day. I do think a little bit of exercise is good in the following day or two. Maybe not going back for a run, but maybe a swim or a little light cycle, a little light walk.
Just to get those muscles moving. And when should they come see you?
Hopefully they won't have to, but if you have to, if it's significant, hey, you can't put weight on something, something that really is painful, then yeah, you should go see a doctor that day or the next day. If it's, hey, I'm just kind of sore, my muscles ache, I don't have the flexibility I had before, that typically resolve day 3, day 4. If it's not really coming around, yeah, the end of the week probably ought to go see somebody.
How can folks find you and your colleagues?
Our website, txortho.com. Look us up on Yelp or the phone book. We're happy to see you. Hopefully you'll make it through without much injury.
Yes, absolutely, and best of luck to everybody taking part this weekend. Thank you, Dr. Smith. We hope folks don't have to see you, but we're glad you're there if they need you.